Welcome back to our slideshow WHP, Women's Health Promotion, your reliable health information source to promote your health and well-being. This is a program of Women Health First, Georgia-based non-profit organization. I'm Nahila Ayeva, Public Health Analyst and Educator, founder of Women Health First. I'm joined today with Dr. Ramatu Muhammad, our Vice President of Public Health Promotion. We are going to talk about the COVID-19 and the ways to prevent the spread of the infection. Dr. Muhammad? The line. Dr. Muhammad?
Okay. Yes, I think we'll get it rolling now. So let's move to the next slide. Thank you for your patience. Yeah, so I would like to start with an overview of COVID-19. I know we've had some previous webinars where we did talk about it, but just for a recap, I would like to go over it again. So COVID-19 was identified in December of 2019, and it's caused by a virus, a type of virus called the severe acute respiratory syndrome coronavirus 2. That's why we call it SARS. So that's like the acronym. And it's a virus in humans that causes respiratory illness, which can spread from person to person through respiratory droplets. And this could be through when someone talks or sneezes or coughs near you within a certain distance. The droplets are inhaled through the nose or the mouth, and they get into the lungs and then cause an infection. People can become infected either by touching hands or objects or surfaces that have already been infected with or that already has the virus on it. And then if you touch it and you touch your eyes, you touch your nose, or you touch your mouth, you could kind of do like a local inoculation, direct spread of the virus. Could I have the next slide? We're going to watch a brief video that shows the data of the incidence of COVID vaccine. Global vaccination. Shows that the deaths, the cases, and the dose testing. And the current cases in Delta variant. That shows the density. And new cases all over the world, the global case. So this is where we got the resources from the Johns Hopkins Data in Motion on COVID-19, and that's the website if you need to keep yourself updated with the information. So we will now just look a little bit, even though that other video kind of gave an overview of cases in the United States, and also just because Women Health First is located in Georgia, so we're gonna kind of, and our population of audience too, there's a lot of people from Georgia, so we're gonna talk a little bit about Georgia. So the total cases in United States are over 40 million. Total deaths from COVID, as you can see on the slide, I don't know, there's a lot of numbers there, but in Georgia, we've had more than 1 million cases of COVID-19, and that is alarming, with about 22,373 deaths from, that's total number of deaths from COVID-19. Could we go to the, yes. And this kind of is a map that shows the flow of how the cases has been. So when it was first found, when it was first detected, COVID-19, you could see that we were at 0, and then suddenly there's this spike where it goes up and then dips and goes up again. But we had like the major cases ranging more than 250,000 in November of 2020. And then it kind of waned towards February. But again, with the upcoming outcome of the new variant, we could see that we're starting to get a rise. As at September 3rd of 2021, we've already gone to more than 150,000 cases daily. So this is a map of daily cases of the incidence of coronavirus infections. Can we have the next slide? So I would like to talk a little bit about the symptoms, even though, yes, we've talked about this before, but one could have fever or chills, cough, shortness of breath, and then there are some people that would have actually no symptoms. And then the new variant of the Delta variant of the COVID-19 virus has a lot of GI-associated symptoms like nausea, vomiting, and diarrhea. Next slide, please. Treatment. There are currently no specific treatment that has been licensed for COVID. However, there are a lot of treatments that are under investigation. There are antiviral drugs like Vaccination for adults, and then certain pediatric patients too with COVID-19 who are sick enough for hospitalization could use this antivirus. Currently, the main care for people that have COVID-19 is supportive. So you treat what symptoms they're having, and if possible, unless they are severe, they should stay at home and manage their symptoms, even though they should report that they are infected. One of the things we're afraid of or we do not want to happen is organ failure. So that is one of the things why we need to be supportive and watch and manage the symptoms as they occur. There's a need to call 911 for emergency cases when somebody has issues breathing, or they have persistent pain or pressure in the chest, or inability to wake or stay awake. And also when the lips turn bluish, that means there is low oxygenation in the system. Next slide. Now I would like to hand over the presentation to my co-presenter, Sister Nahila Ayeva, our public health analyst and educator and CEO of Women Health First.
Thank you so very much, Dr. Muhammad, for this beautiful so far presentation, giving us important information. Yeah, prevention. That's a key element for this whole presentation. Well, prevention is what we need to do, as a public health. Prevention is the key for everything that we do, yeah? And the basic things such as hand washings, is a very crucial, and we know that, right? And during this pandemic, they also advise us to wear a facial mask, and then also have at least 6 feet, social distancing, right? And now touching your faces, your mouth, and all those kind of stuff, we already know that, because when somebody asks you, what is public health? It's about everything that we know, but we wait for somebody to tell us, and we still don't do, right? So that's what it is, because this is the basic things that we do, but we take them as granted. That's what is the prevention. But again, when the prevention did not work or fail, I'm not going to say fail, but if there is no way of containing the prevention as a first line of prevention, it moved to second line of prevention, where at this point a lot of things need to be done, which is including vaccination. At this point, CDC recommending all of individuals 12 years and older to really consider vaccinated. Wow. Of course, we are hesitant, and we understand that, but why it's very important to have the vaccine, we will talk about that. But at the same time, it's very interesting for us to remind myself and all of our audience that it's very normal to be hesitant about taking the vaccine, nothing wrong with that. And this is a simple because there's sometimes a lack of confidence and effect of a low level of a trust in a vaccine themselves and the delivery system, because the delivery system, which is a healthcare delivery system itself, can be corrupted sometimes. And also the authorities, influential authority member. This may including also doubt about vaccine efficacy and motivation for people to take those vaccines. Now, our goal here is not to tell everybody to convince you to take the vaccine or not to take the vaccine. Here, we are here to really just convey you some information, the basic information for you to make informed health decision. So it's up to you now, after getting those information, to decide for yourself and see if those vaccine is right for you at this time or not. Now, so, well, on this slide, it says why vaccine is very important. Well, we will say that vaccine is important at this time because of what we're seeing. We see, as Dr. Muhammad present earlier, we see the incidence of prevalence of the cases rising because of this new Delta variant. Delta variant is a new fancy name. It doesn't mean nothing. It just means that the virus has mutated and have taken second form. So, well, they don't want to call the first one Alpha variant because they did not anticipate that something else will come on. So it's just first Alpha and the second one, Delta variant. That's what it is. So by what we're seeing those things has been increasing, there is a need for you to think about all that's going around. We see a lot of death. We see a lot of, sick people, the prevalence of morbidity, and then fatality rate is very high. It's pretty high for her to think about those things. So from the June also this year, from mid-June to August, there was 10 times increase in the rate of hospitalization among the children. We're talking about ages 0 to 4 due to this rising of Delta variant. So this is this can really raise eyebrow. Among all those things that we're seeing that, making so scaring for our situation, we also realized that recently the Food and Drug Administration has a full approved the Pfizer BioNTech vaccine, to preventing COVID-19 in the case of children or young adults from age 16 and older. This is a calling, at least for the achievement, a great achievement for public health in general. So for that, it's a lot of work. What that means, somebody will say, but well, the vaccine was not approved before. We indeed, yes, it was approved based on a clinical study, intense clinical study. And then at that time, Food and Drug Administration has allowed immediate emergency utilization of the vaccine, also called EUA. So at this point now, the vaccine has reached the efficacy that has been exponential, that has granted the Food and Drug Administration, FDA, to now fully, approve one of the vaccine, which is a Pfizer BioNTech. Yeah. So that also can help people who are hesitant to think about, again, what else can be, handicapping them to take the vaccine. Now, and also that vaccine has been safe. Therefore, they say that it can still be utilized as emergency utilization in the case of the children under 16 years old, talking about 12 to 15, and also in people with immunocompromised, such as people with a lot of diabetes, severe chronic diabetes, or high blood pressure, or hypertension, or many other diseases as a cancer. Now, so another thing we have to consider that is very important at this time is that not only the rise of the Delta variant, but also many people with the COVID-19 don't have symptoms, and then they can be also spreading the virus. So that's where the problem really is. So this is a time for us to really turn on it and say, you don't really know who has the virus or not. And, to understand that is very important. Yeah. So like I said earlier in the previous slide, on August 23rd, 2021, the Food and Drug has first approved the COVID-19 vaccine. And the vaccine has been known as the Pfizer-BioNTech, and his name given to him right now officially is a Comirnaty. So this is a success for those people working in those areas of public health. Before the vaccine has been approved, officially approved completely, meaning that raising from emergency utilization for full approval, many places, a lot of other people has been taking the vaccine, and this has been also mandate for other people in a government setting. People just work Federal Health Department and Health and Human Services, including Veteran Affairs, had been mandated their employees who work with the patient to really get vaccinated before. So that doesn't mean nothing. When I say it's fully approved, it was confusing. My son was asking me, so it was not approved before. So I would like to pause a little bit to make a clarity. It was approved for emergency utilization back then, with a 95% of efficacy. So it's amazing at that, but now has reached to another level. Yeah. So let's explain exactly and ask ourselves, what is the vaccine? What is exactly the vaccine? Well, very simple, because again, this is not academic paper. We're working in a community setting. We try hard to really make it simple so that we can understand the basic things in here. We also respect that we have a various audience with a different academy level. Well, but this presentation is a community health promotion. Yeah. So the vaccine teach our immune system how to recognize and fight the disease. It's very simple. So that's what it is. And a vaccine is what? Is a medical tool used to prevent the occurrence or severity of the disease. Let's pause here. They did not say that the vaccine is there to prevent you from disease. No. You can see it's either or. Occurrence of disease, meaning that prevent you from getting the sickness. That's one, depending on your immune system, and also the severity of that sickness or the disease, if you mean to. So it means that you may still have a vaccine, which we're going to move to the next point, but I'm going to pause in here in a minute to explain that you may still have the virus while you're already vaccinated. And we see it during this case, during this pandemic. Now, so what is the fact about COVID-19 vaccine? Well, we have 3 vaccines that we're going to talk about that is approved in US to use, which is Pfizer-BioNTech, Moderna, and then the Janssen. Janssen is a vaccine for Johnson & Johnson. So those 3 are full approved to utilize. Those 2, the last 2 is approved for emergency utilization, like I discussed previously. And the only so far approved vaccine as of today that we know of is the Pfizer-BioNTech. The Pfizer-BioNTech vaccine has been a vaccine that was generated through the new technology. So it has raised a lot of eyebrow and a lot of concern, which is very legit. So those 2 vaccines, the Pfizer-BioNTech and the Moderna, are using different way of designing the vaccine. They're using mRNA, also called as a messenger RNA, to prevent the disease. Same way as the previous vaccine, but it's a little bit different way. But for that thing, it's something new and has created a lot of a problem for those who are opponent of them and those who are opposing of those things. But we have to ensure you that a lot of study has been done and they have been proving that their efficacy, that's why they are there. So this vaccine, messenger RNA vaccine, do not have a lot of viruses, so therefore they don't cause you to have the disease. They don't cause you to have the disease. Okay, that's number one. They do not affect or interact with your DNA, like they said. That is a fact. In any way, they do not interfere because they are on a surface. They did not reach the genetic membrane of the cell that we know. So that's where the DNA is kept in the nuclei of the cell. So this way of doing the vaccine they did not use nuclei. So therefore, it does not change you like the way we see it in a doctor, with a doctor, how you call it? Dr. Wasaf. We love it, right? So we just have to clarify that now. We have to move on and talk whether the safety of the vaccine, right? The COVID-19 vaccine are safe and effective. Safe in terms of the clinical study, the number of people that they have utilized, and a lot of things that undergo. The vaccine have undergo and will continue to undergo the most intensive safety monitoring in US history. None of the vaccine has been given attention for people to work hard, to really, ensure the safety of this vaccine. I don't work for any of the vaccine providers, but we just ensure you based on the science that we're receiving, based on the people that are still working there, and we're talking to them on daily basis. It's people like me and you working on those teams as well. So therefore, over 369 million doses of COVID-19 have been given in US. And this data is from December 14 up to August 30th for 2021. Well, it's very interesting that if you are full vaccinated, you may or you can resume activity that you did previously before the pandemic. Well, but highly recommend that you continue wearing your facial mask and observing social distancing. Like I said again, millions of people have already received the vaccine. So it's very good to join them, but again, discuss with your medical provider on individual cases. Discuss with your medical provider. Both the vaccine and the disease is new. So just have a disclaimer there to pause on a minute and say, anything you do, this is the informational section, and discuss with your medical provider. Now, thank you very much for this part of my presentation. I'm going to move on to let my colleague, Dr. Muhammad, go in and then continue with this presentation. Dr. Muhammad is a family practitioner in Nigeria who has been seeing a lot of cases in tropical medicine. So she's a well-versed to really take this side of her presentation. Dr. Muhammad?
Thank you, Sister Nahila. Okay, so can we go back on my slide? Yeah, I will be talking about the side effects that people see with the vaccine. I think we just hopped into the next slide. Can we go back to the slide that has the side effect? The main common side effect is that there's redness at the site, pain and swelling at the injection site. I'm sorry, the slide has gone further. Another thing is that people could experience fever or chills associated, usually seen with the second dose of the vaccine. Another side effect is muscle pain and tiredness. And some people did complain of nausea. So these are common side effects that happen with the vaccine and usually more common after the second dose of the vaccine. So there are some safety concerns that we would have to highlight here about the vaccine, just because CDC and epidemiologists all around the world are watching all this closely and collecting data. So since it's a new thing, we don't stop collecting data. And one of the things that is mandated on people who have been vaccinated is to report any reaction or side effect that they experience from taking the shot. So a small number of people have actually had severe allergic reaction, which is called anaphylaxis after the vaccination. This is not only with COVID vaccine, it could be seen with any type of vaccine. Some people, their body reacts to the things that are mixed to carry the vaccine, the inoculate for the vaccine. There is also a need for me to mention that there is high occurrence of blood clots with low platelets. This is medically called thrombosis with thrombocytopenic syndrome. Is an adverse effect for the Johnson & Johnson COVID vaccine. And I know that in the United States, people, it hasn't been mandated to use AstraZeneca, but this is also highly seen in the AstraZeneca vaccine. So it's also common. I shouldn't say highly so that we don't look at it as a number. It's also seen in AstraZeneca and it's also seen in Johnson & Johnson, but more common in those that take the AstraZeneca. There's also a rare case of myocarditis and pericarditis in adolescents and young children. This is inflammation of the muscle of the heart or the covering. So there's this thin membrane called the pericardium. That's the covering of the heart, which also could become inflamed as it's been seen after the younger kids or the young adults take the second dose and the adolescents of the coronavirus vaccine. Usually either the Pfizer or the Moderna. CDC continues to monitor closely the safety of the vaccine. So they would not stop, they're still monitoring, and the more people report back what they experience, the more data we'll have on what we should be cautioned about. Next slide, please. As mentioned by Sister Nahila, so this is a quick slide. These are the vaccines that have currently been authorized and recommended in the United States. Next slide, please. So I would now once again hand over to our prevention specialist, Sister Nahila, if you could continue. Thank you.
Thank you, Dr. Muhammad. Well, further ado, we would like to continue by saying that everyone from age 12 years of age and older is now eligible to get a free vaccine. The vaccine is a free, regardless of your immigration status of your financial status, none of them, and social economic status. The vaccine is a free. And again, we recommend that you talk to your healthcare provider. You know, as this vaccine, as we saying earlier, is pretty new, and the disease also is new. So nobody knows you better than your healthcare provider. It's very crucial to consider one of the next level of prevention, but at the same time, do not neglect the previous line of prevention, such as washing your hand, wearing your facial mask, observing social distances, getting some good rest, eating good, increase your fluid intake. And in this case, we're going to recommend that you drink a lot of hot liquid, hot soup, and the green tea. I'm not marketing for none of them, but they're just so good. The one from Kroger is one of my favorite, and it's always good to have those things even before you go. Reduce your ice intake, and those are very, very important. When you do all those things and you're still in a need to take a vaccine, while it is safe to take them, once you talk to your medical provider, she or he will guide you to select the best vaccine. So how do you search for vaccine? It's very simple. You just go to vaccine.gov, or you also test on your phone your zip code to the number 43, 88, and 29. Or you can also call the 800 number 232-0233 to find the COVID vaccine location near you. The further information is there, which is your local pharmacy. The website is have a ton of information about your vaccine availability and appointment. Some of those sites does not necessarily need the appointment, but the best one is to make appointment. That way you ensure your spot. And then also find out if your pharmacist is participating in a federal retail pharmacy program, you know. And one good news about that is that if in the future, after your vaccination and you don't have insurance to take our other medical care, by you going to that location, you can get a follow-up visit and get chance to get seen and at least get your physical, especially the women, and get those mammogram and pap smear. All this is in a combo based on the vaccine. So it's very interesting, especially when we're dealing with a underinsured or undocumented immigrant in our community. Now, another thing to do is to contact your state health department to find additional vaccine location in the area. You can also check your local news outlet. There are many. They have many information and then about vaccine and anywhere you can go. And of course, if you reside in Georgia, the best place to be is the Georgia Department of Health, and they will provide you with a great information. And furthermore, you can always visit the CDC and to have a great information and then seek more knowledge in terms of what exactly they're doing and following the data that was collected daily. Yeah. Well, this is our references. Is a lot in here. Mostly, basically, we've been following CDC and reading those reviews and looking at them. We're looking at the Pfizer data as well. We're looking at Georgia government sites and see and carry some information. And we're also looking at various community sites, including the new technology. So we have a various sites that we reference from. And for more information, you can always feel free to reach us and womenhealthfirst.org. You can always go to info@womenhealthfirst for any clarity or any further information. Remember, this is just for community setting purpose. Well, at this time, we would like to thank you so very much for your time and valuable information. And Dr. Muhammad and I, at this point, will take any question that you may have, and we will we'll be taking any question that you may have. Thank you very much. Dr. Muhammad?
Thank you so much, Sister Nahila, for this. Even though it's a community-based webinar, there was a lot of very good information in there, technical information in there. So do bear with us. We try to cover as much as we can. Please, if you have any questions, feel free to ask so that we can answer your questions. Okay, yes, we found someone. Thank you. Bidemi is asking, if there are side effects, where can one report this? So whoever gets a COVID shot here, you're usually given a flyer that has information of where to submit, but it's usually a CDC site that you go in and submit. You could either call or you could send it as a message, or you could go to their website and report the side effect. But everyone that gets the vaccine in the United States, because I have gotten mine, I was given a pamphlet of where, and in fact, it even has a barcode that you can just scan with your phone camera, and it takes you to the site where you report the side effect. And this is collected directly into the data. And after that, they follow you up. So depending on where you are, which I'm not sure, because we have audience from different parts of the world. If you are in Nigeria, I'm aware that the NCDC also is a place where one can report either being infected or a side effect to the vaccine. If you're in America, the CDC collects that data. So I wanted to talk a little bit in case, but you could keep asking your questions, but just because I know this is the issue of the infection in children. Postulation goes that why cases are seen more with the Delta variant still goes back to the vaccination. So just because all kids less than 12 have not been authorized to get the vaccines yet, that's probably why they're seeing more cases of Delta variant in children, just because there's a significant number of adults that have had the vaccine already. In fact, recent data has it that about 2 billion people worldwide not only America. In America, it's in millions, but worldwide, about 2 billion people have received the vaccination. Another thing I want, just if you can ask your question, let me know and I would stop, but I'm just trying to give a little bit more information. There's a lot of question about kids presenting with multisystem inflammatory syndrome. So I wanted to talk about that and just say a little bit about what it is. So a multisystem inflammatory syndrome that is seen in children is a serious condition where different parts of the body can become inflamed. And this include the heart. You remember I mentioned the myocarditis and the pericarditis, but those are not the only organs. So because we said multi-system, that means it could also be inflammation in the lungs, the kidney, the brain, the skin, the eyes, and the gastrointestinal organs. And for more information, you could visit the CDC website. I can hear someone's mic going. If you want to ask a question, I will just keep quiet now and feel free to ask.
Yes, Dr. Muhammad, can I add something?
Yeah.
Yes. For the sister Bedimi that asked the question also, as you mentioned, is another thing that they do is you have a V-Safe where there's the portal or database where CDC collects all the personalized health check-in after you are received the vaccine. So you can also do that online. And another thing is that they also have a VERS, which is a VAERS, which is a vaccine adverse event reporting system, and is a national system that collects reports for adverse events that happen after the vaccination. So those are the things. We're going to share it with our WhatsApp platform as well later on today. Any other questions, sisters? This is a Q&A time, so we can answer much question. If not, Dr. Mohammed, you have something that previously they asked, and then will you go over some of those questions?
Yes. So just, I know we touched a little bit about this in our presentation because one of the questions people keep once I'm COVID positive, what happens? What do I do? I would just like to go over that a little bit. The recommendations for someone who has symptoms of COVID-19 is first and foremost, stay at home, except having the medical care. You should isolate yourself from people in the house just so that you can protect them. You should monitor your symptoms. So monitoring symptoms include checking your temperature every morning. You check your temperature and you document it, write it down just so that you can see the pattern. If you're having issues of breathing or difficulty breathing or symptoms like bluish discoloration of the lips, please do call the emergency or visit the closest emergency room next to you. Another thing is, even though you already have the COVID-19 infection, you need to keep your face mask on so that you prevent spreading it on surfaces and people around you. Cover your coughs and your sneezes. Still wash your hands as often as possible. You have to also clean high-touch surfaces every day. So your doorknobs, your toilet flush handle, the taps that you use, things like that. You have to clean them every day, and then avoid sharing personal household items. That is for people that have the infection and are having symptoms of COVID-19 while they're in their house. Any questions? I'm just trying to look at most frequently asked questions.
Dr. Mohammed, I would like to shout out Dr. Habiba from London joining us. Dr. Habiba, do you have anything? Thank you for joining. Yeah. Dr. Habiba?
You're putting her on the hotspot. She doesn't want to talk.
All right, she's probably, okay, right.
Yeah, so my own is not actually about questions. I know that I have some doctor colleagues here. If any one of you has anything they want to educate the population about, or our audience about COVID-19 prevention, We have some epidemiologists here. I will not call names. If you feel you want to add something, you could unmute yourself and say something.
We have another question here. It says that do COVID-19 vaccine contain microchips? That was a question that they sent on our WhatsApp group. We answered that, but this is another great opportunity to share that because it has been circulating a lot, Dr. Muhammad. As you know, there's a lot of misconception about those vaccines, but we just have to convey the fact. Yeah. So the question is, do COVID-19 vaccine contain microchips? The answer is no. COVID-19 vaccine do not contain microchip. Vaccines are, like I mentioned earlier, are developed to fight against disease and are not administered to track our movement. No one would like to track that. Your phone, your cell phone is just good for them to track you. Yeah. And vaccine work by stimulating your immune system in general to produce antibody, exactly like if you will have to have the disease or exposed to the disease, how your body reacts. That's exactly what vaccine does, as I explained earlier. So after getting the vaccine or after being vaccinated, what happens is that you develop immunity to that disease without having to get the disease at the first place. That's what it is. So no, the vaccine does not have microchips.
Yeah, and I just want to, okay, Sister Jamila, you're unmuted. Do you want to ask a question? Oh, sorry, maybe she wasn't.
Yes, Dr. Jamila, come in. My screen is covering, so I can't see the rest.
No, Dr. Jamila just unmuted herself. So, Dr. Jamila, you want to say something?
No. That was a mistake. Sorry.
Okay, that's fine. I just want to reiterate this part, just to talk about when one should consider going to test for COVID-19. Obviously, people who have symptoms should go get tested to know whether they have COVID-19. People who have had close contact, with the exception of some situations where if you are fully vaccinated and you came in contact with someone who told you, oh, I tested positive and were in close contact. So if you have been fully vaccinated, you do not have to go back and test if you have COVID unless you start having symptoms. Also, anyone who had previously tested positive within the past 3 months and they have recovered from the infection, if they were told that they were in contact with someone who has recently been diagnosed positive with COVID-19, then they also do not need to go back and check if they are positive unless they have symptoms. And then also, if you have taken part in any risky activities that might have predisposed you to having been exposed to the likelihood of an exposure, even if you don't know if anyone in that crowd had COVID, you could also go and test. And then people who have been asked to go and test by their medical professionals should also go and test. Dr. Halima has her hand up. Thank you so much for raising your hand. Unmute yourself, please, and feel free to contribute or ask a question, whatever you can. Thank you.
Okay, good evening, everybody. My name is Dr. Halima. It's a pleasure being on this forum, and I want to appreciate the organizers of this program. Is quite educating and full of knowledge and information. So I don't know, I joined in a bit late, so I just wanted to get a bit of clarification regarding the safety of COVID vaccine, because I can see we've been talking about, I'm not actually being biased, but I've noticed that we've been talking more of the American COVID-19 vaccines, which are more commonly used there. That is the Moderna, the Pfizer, and the Johnson & Johnson. And also you have, in the US, it's like you have used a lot of doses, more than any other place. From the previous slides that were shown, you like covered like 300 and something million doses. So my concern is, as regards, apart from side effects, I didn't see you talking about, the generally the population. Are there people that you think this vaccine is contraindicated in? For example, also, in addition to that, is there any risk or association regarding using it in breastfeeding mothers or pregnant women? So I think that's 1, 2, or 3 questions or areas that I want you to give us a bit clarification or shed more light on those areas. Thank you very much.
Thank you so much, Dr. Halima, for this. So for those that don't know, Dr. Halima is forefront in Nigeria. Actually, I know her. When I heard the voice, then I realized this is the Dr. Halima I know. So she's forefront in Nigeria. They're the ones that are administering the COVID vaccines to the Nigerian population in the Federal Capital Territory of Nigeria. So very good questions there. I know you asked several, so I'll try to answer. As regarding pregnant and breastfeeding women, it was just recently approved that they could have the shots. Initially, because they didn't have enough data, they didn't recommend it in either pregnant or breastfeeding women, but they have seen that the benefit outweighs the risk, especially pregnant women who have been experiencing miscarriages of recent from being infected with COVID-19. So right now they have recommended that it is safe to give breastfeeding mothers and even pregnant women. Can you repeat the first question? You said something about, there was the initial question, I lost track of what you had asked me, the first one. Dr. Halima, if you are still there, if you could. There was something you talked about, I think comparing the safety, right?
No, she was talking, yes, Dr. Mohammed. Thank you, Dr. Halima, and thank you, Dr. Mohammed, for answering that question beautifully. Yeah. Dr. Halima was, and also I thought it was Dr. Halima, one of my friends, also medical doctor ophthalmologist in London. So I thought it was her. Yeah. Anyway, Dr. Halima would like to know the safety, like in terms of, is it a one shoes fit all? That's what she want to know.
Okay. Yes, I remember now. Okay. So it is not one shoe fits all. Even in the United States, that is why Dr. Sister Nahila, when she was presenting, really, I know you said you missed the beginning, but she reiterated that we are just informing people of the need and the information that is available for COVID-19, but there's always the need to check in with your doctor. So if you, especially if you have coexisting medical conditions, it is very important that you check in with your doctor. But based on personal experiences, I would tell you that most doctors in the United States have actually recommended clients that have immunosuppressive illnesses to get the shots. So there's more of a pro-vaccine amongst those population to protect them, just because their presentation and severity of illness when it comes to chances of mortality or severe morbidities is really high. What I mean, let me just go a little bit late, is that those that have immunosuppressive illnesses tend to have a severe form of COVID-19 when they do get infected with COVID-19. And also more cases of deaths are seen from people that have comorbid, coexisting medical conditions, including the immunosuppressive illness. Yes, thank you. Sister Nahila, could you just play this a little bit? I think maybe Dr. Halima missed this one, but another thing is you could actually also go to the Johns Hopkins University daily COVID-19. This data in motion did actually mention how the cases have been, the deaths, the incidents, the new cases. This is a very good resource. It's just a 1-minute clip. That is the website, and they give daily updates on current situation with the COVID-19. I hope this would be a good resource for you, Dr. Halima, that you could actually see what's going on. And thank you for very, very good questions. We have a question that I just noticed in the chat. Someone has asked, Nafisa asked, can you contract COVID-19 twice? Yes, you can. Those vaccinated can also get it. It's just that the severity of the disease has been seen to be markedly, they may not even have symptoms, or if they do have symptoms, some of them have mild symptoms. Needless to say, probably some with coexisting condition could present with a little bit more severe symptom, but also it's usually way better when you compare the data than somebody with a coexisting medical condition that did not have the shot and eventually did have COVID-19. So yes, one could contract COVID-19, but based also on the data, it's been seen that at least 3 months apart from the last infection, that is when someone can get a reinfection, just because immunity, even as we have seen with the new need for the third shot, is that from 3 months to 6 months post vaccination, the immunity that one has incurred from the shot starts to wane. So when I mean wane, I mean it starts to go down. So like 3 months, probably about 73%, but by the time one hits 6 months post vaccine or infection, depending on what predisposed you to the immunity, it's been seen to drop as low as 53%. So that is why right now the government here is recommending third shots, most especially for people at high risk. That means healthcare workers or people with any immunocompromised situation that would cause severe disease. They have been approved to get the third shots here in the United States. And it just happened in August, like late August, that it was approved. Any more questions?
Well, Dr. Mohammed, we take
Oh, our time is up. I just
take an opportunity to thank all our audience. Yeah. Especially we have a brother Sunny. He did not participate, but he was there and listened with attention. So we really appreciate you leaving your duties and your obligation to really come and support our program. We appreciate you being on the board. And we thank all our audience. We have Sister Zulifa, Sister Nafisa, Sister Zainab, and all of our sisters I cannot see my screen is covering. And we really thank you to be here today. Without further ado, I would like to let Dr. Mohammed to do the closing remarks, and then we will call it for the day. Dr. Mohammed?
Thank you so much, our audience. Thank you, Sister Nahila, CEO, Women Health First, for bringing this to the community and educating people about the needful and things that are important health prevention measures. Once again, thank you so much for those that have contributed, those that took time to be here. We really appreciate it. And from yours truly, Dr. Ramatu Muhammad, it's been a pleasant day. Have a pleasant rest of your weekend and Labor holiday for those in the United States, and pleasant week for the rest of the people around the world. Thank you so much for being here.
Thank you. We appreciate you.
Thank you, Dr. Halima.
Jazakallah khair, and Doctor.
Thank you.
Very informative.
Thank you so much for the presentation. We really learned so much from it. May Allah subhanahu wa ta'ala increase you in knowledge and understanding. Jazakallah khairan.
I mean, thank you so much for everyone that was here. Thank you. Sister Zainab, thank you also. I just saw Zainab on. Thank you for coming on, and we have just rounded up the webinar. And this would be made available as a recording on our YouTube page, and in podcast format, and we would share it with anyone who needs it. And it will also be available on the WhatsApp group. We have a Women Health First WhatsApp group. And do indicate to us or send us an email if you want to be added to that group. Thank you. Thank you for being here.
Thank you. Thank you, Dr. Mohammed. And this brings us to the end as we live in. Ciao.
Good night.
Good night. Bye-bye.
Bye.